Welcome to our 36th Open Mic webinar. This week, our topic is on the latest trend and innovation in Parkinson's disease diagnosis and treatment. Now, this week, Dr. Van, who is our chairman of the Medical and Scientific Advisory Committee, he's on call, so he has Dr. Lin to substitute for him. So I'll share with you guys a recap or summary of what Dr. Lin presented to members of our leadership team. First off, Dr. Lin went into the discussion of Parkinson's disease by going over the causes of the disease. Now, I know that most investors are not interested in learning about underlying science and medicine of Parkinson. You prefer to know which stock to invest, and that's how it is for most investors. But by understanding the science and medicine of companies that make drugs to treat Parkinson, you gain a huge advantage over the rest of the market. As a result, I highly recommend that you watch this video and pick up the underlying science and medicine as you go through different company for you to potentially invest in. Contrary to what you think, Parkinson's disease, it is most of the case is idiopathic, or there's no genetic cause. It just happened by chance. But there are a smaller number of cases in which there's a genetic component, like certain gene mutation associated with Parkinson's disease. And then there's also the environmental factor. If you recall, the boxer Muhammad Ali, he suffered from Parkinson's disease, and part of it is due to his occupation being a boxer.
So today we're going to talk about Parkinson's disease. What it is basically in part of the brain where it regulates motor skills. There's a lack of dopamine. So that's really the key chemical, the dopamine in the brain, which help that part of the brain to control movement. So if there's less dopamine available, then you have troubles with your motor skills. What are the causes? I said earlier is idiopathic in most cases, but certain genetic factor, certain mutation has been linked and identified certain type of mutation can cause Parkinson's disease. Pesticides, the environmental factor, like I said, heavy metals can also cause it if long exposure.
Dr. Lin also discussed about the sign and symptom of Parkinson's disease of the movement disorder, because underlying cause of Parkinson's disease, and as Dr. Lin shared with us, is due to the deficiency in the enzyme in the area of the brain called the substantia nigra that makes the neurotransmitter or the molecular signaling molecule of the brain, and they are called dopamine.
Vocal symptom we'll talk about is very soft, whisper kind of voice. Rigidity and postural instability. They can't really move. They're very rigid. They move. They kind of like a walking gait discomfort. You see people kind of like a shuffling of the feet. That's when you people walk and they kind of shuffle the feet. They take really broad strokes in the gait, right? So that's the sign of Parkinson's. Tremor is very common, where they get very shaky all the time. Dystonia, just kind of movement of the body with kind of twisting. You're putting yourself in the body motion that's very awkward, looking very unnatural. So the non-modals, it's not as prominent, but of course we talked about earlier about cognitive dysfunction, you have anxiety, depression. One of the things that I find is very interesting is the sense of smell. People who Parkinson, they say 75 to 90% of them lose the sense of smell. They say it's actually considered a marker. If you're very young and you can smell your food, there's a good chance that you may develop Parkinson's when you grow older. GI issues, the problems I mentioned earlier, is the autonomic nervous system is associated with the GI system. So a lot of that can associate it. And of course, any symptom got also social pain with all this dysfunction going on, pain can be a problem as well.
So currently the mainstay treatment, as Dr. Lin went over, has been on replacing the dopamine. And the key dopamine that are replaced as treatment is the levodopa. The other replacement that Dr. can do is also another form, and that is carbidopa. Other drug used to treat Parkinson's disease is the enzyme, or the two enzymes that prevent the dopamine from breaking down. First one is monoamine B inhibitor, or MAO-B inhibitor. The other enzyme drug that being used to break down dopamine is the COMT inhibitor. So by inhibiting or suppressing the enzyme that break down dopamine, we can keep dopamine level higher in patients who are afflicted by this neurodegenerative condition.
There are multiple classes of medication that is used to treat Parkinson's disease. The cornerstone, or called the gold standard, is levodopa. Now, levodopa is considered a precursor to dopamine, meaning that it converts to dopamine in the brain. Sometimes it's given with carbidopa as well. Now, carbidopa basically is a medication that prevents the breakdown of levodopa in bloodstream. So those combinations help to elevate dopamine in the brain to help reduce Parkinson's disease symptoms. The second class is a dopamine agonist. This basically, they act like dopamine, so they kind of like bind bind to receptor dopamine and activate them. Another class is called the MAOB inhibitor. MAOB stands for monoamine oxidase B. Now, the MAOB is actually an enzyme that breaks down dopamine in the brain. So if you have an inhibitor that prevents that, then of course increase the level of dopamine in the brain. So therefore, it helps with Parkinson's disease. Another class of medication is a COMT inhibitor. COMT is also an enzyme that breaks down levodopa in the body before it reaches the brain. So an inhibitor, if it inhibits that, then of course increase the level of levodopa in the body, which then of course going to help increase the dopamine and of course help with the symptoms or Parkinson's disease. Right?
Shifting gears, Dr. Lin presented about the investment opportunity in this space. We discussed different companies that make good prospective investment, as well as a company with investigational drug in this niche. A promising area for investment in this niche would be a company that makes diagnostic, for example, with improved diagnostic that allow a physician to pick up the disease faster, and with earlier diagnosis, we can initiate treatment, which will alleviate the suffering for the patient, as well as affecting the disease course earlier. The other promising company would be one that makes, for example, gene therapy to replace the damaged neuron or the non-functioning neuron in the area of the brain that makes the dopamine that is in the substantia nigra.
So what stocks out there, we talk about Biogen is a gene therapy development, a potential genetic treatment for Parkinson's disease. Ansevent Gene Therapies is a similar category. Anavex Life Science is the company that we talk about that developed the medication to treat Parkinson's dementia, right? So that's one of the medications that we want to keep an eye out for.
If you enjoy our video, make sure you hit the like button, subscribe to our YouTube channel, share it with your friends and your family. Also, just tap, you don't have to smash on the bell notification button so that you can get our video as soon as they are released. Now, the other thing I want to share with you about is that our fund, we have weekly open mic webinar where our leadership team meet, and our chairman of the medical and scientific committee, that is Dr. Van Nguyen, he's a cardiologist, also medical director. And he and our team present on the latest advancement in the life science sector. We cover many niche, many topics, which allow me to gain an advantage in the life science sector. And in knowing so, I can fine-tune my research position and invest in young, innovative companies before they blow up big. Let us capture the tremendous upside in the biotech stock market that will occur in the next few years for you. If you're interested in learning more about our fund, you can check out our website, www.evergrowthinvest.com. You can also reach us by email, info@evergrowthinvest.com, or by phone, 704-957-7746. Reach out to us to see if we are the right fund for you and if you are the right investor for us.